A nurse's view as the patient is our episode topic. Rejoining us as a guest for this episode is Terry Foster. Terry is a well-known national speaker both in and for nursing and was the first nurse to appear on TLC's Untold Stories of the ER series. Terry is without a doubt an uplifting and supportive nurse for any patient or colleague that interacts with him, and he used these talents during his most recently completed term as the 2023 president of the Emergency Nurses Association. Terry is a clinical nurse specialist at St. Elizabeth Healthcare in Northern Kentucky. So let's get started.
Welcome to the BRG Nurse Executive Podcast. BRG is a global consulting firm that helps organizations in disputes and investigations, corporate finance, and performance improvement and advisory. BRG's healthcare performance improvement practice offers multidisciplinary services to healthcare organizations. We focus on implementation with innovative, independent, and data-driven solutions. In the BRG Nurse Executive Podcast, we discuss improving patient care by advancing nursing leadership. For more information about BRG, please visit thinkbrg.com. Now here's your host, Nick Chmielewski.
Terry, thank you so much for joining us again.
Hi, Nick. Thanks for having me back.
You recently had, well, by the time this airs, it'll probably be about a year. Within the last year, you've had an experience of being on the other side of the bedside. And so many nursing leaders get to hear the bad things that happen. Maybe there were some opportunities for improvement, but a lot went right in your care. Tell me about your experience.
Sure. I hit an inferior lateral MI, STEMI, on November the 2nd while I was in Lexington, Kentucky, and I was slated to be the opening speaker at their conference. I went out to dinner the night before with a small group, a committee group, and people always ask me, what'd you have for dinner? And I had salmon and a salad and asparagus. So there you go. Okay. And
Very healthy dinner.
Oh, and they're thinking of big old steak and sour cream and butter on my baked potato and all that stuff. But so anyway, went back to the hotel, went to bed about 10:30. I woke up about 5 a.m. with a little bit of chest pain on a scale 1 to 10, maybe a 1. I thought it was a pulled muscle, took an ibuprofen, laid back down, woke up about 5:45, and I was like, this is feeling a little worse. And it was then about a 3, and I was like, something's going on here. So I didn't know what to do. And to be honest with you, it was not denial. I just was like, I don't know if this pain's here or not. I had no other associated symptoms, but I remember very well, I was in a hotel room by myself. And I thought, if something's going on, I need to get out of this room. And within about 10 or 15 minutes, the pain was getting intense. I got diaphoretic and I'm like, okay, so I unlocked the door and got dressed. I didn't brush my teeth or shave, but it was at 6 a.m. and I knew that the committee of about 5 emergency department nurses were setting up literally right down the hall in the lobby for the conference. And I thought, I need to go down there. I thought about calling 911 from my hotel room, but I wanted to be around other ER nurses. And I thought, if I drop over while walking down the hall, somebody will see me. But I got dressed and I took my cell phone with me and I went down there, and the first nurse I saw, I said, I'm having some trouble. I think I'm having an MI. He said, okay. And then 2 other nurses came up and they're like, what's wrong? And of course, somebody said, you look like crap, except I cleaned it up and said crap. And as only nurses say, we're very direct and stuff. And I said, I need help. And
these
so
were
anyway,
nurses that knew you?
Knew me, yes. It was several of that Lexington chapter who I've known for years, and
Okay.
they're experienced emergency department nurses. And they said, we're going to call 911. And I said, please, yes, do. And what emergency department nurse wants 911 called on? I certainly didn't, but I knew that is exactly what I had to do. There was a little room off to the lobby and he had 4 chairs in it. And so they put me in there and I sat there and I could look at my hands. My hands were gray. I was diaphoretic. I was nauseated. It was just classic. And so they were very reassuring to me. They're like, the squad's on the way. hang in there. They were checking my pulse. I noticed them moving. They moved 2 chairs out of the room inconspicuously. And I remember thinking there, because it was a small room, they're moving those chairs out in case they have to get me on the floor and do compressions. And that was very sobering. But I remember thinking I would probably have done the same thing instead of no room to do compressions. And that's rough. And so anyway, the squad came and they had called Patty Howard, who runs the emergency department at UK, and she was en route to the conference. And
Friend of yours.
yeah, very close. And they said that she was coming and they were going to take me to UK and stuff. And the squad got there and they got me on the stretcher, put me in the back of the squad. She jumps in the back of the squad. They got a line in me, did a 12 lead, and I wanted to see my 12 lead. Patty said, "You don't want to see it." And I said, "Yes, I do. Steam stones and leads 2, 3 and AVF and
Wow.
reciprocal changes." And I just looked at it. I just couldn't believe that it was me. And I don't mean denial. I knew what was happening, but I just couldn't believe it was me. And so they said, "We're going to take you right to the cath lab." I would tell you, your listeners, if you're going to have an MI, have it at an Emergency Nurses Association conference on a weekday when there's a fully staffed university hospital cath lab within 1 mile of where you are. Okay. Not that I plotted all of that out, but everything, all planets were in alignment or divine intervention, however people want to take that. It was very much meant to be. They transported me. They were very kind, reassuring. I don't remember if they gave me anything for pain. By the time I got to the hospital, the pain was incredible. I just couldn't believe how much it hurt. But I do remember thinking when they asked me on a scale of 1 to 10, I can't say it's a 20. It's a 20 because that makes everybody mad when you say that. So I was like, it's a really bad 10. But I didn't want to be like, oh, he's a male. Okay, they're wimps or whatever. But it was crushing, intense pain like I've never had before. As I went through the emergency department to go up to the cath lab. And what I remember vividly is the staff looking at me with this dread. Is I have looked at so many patients that have come in and looked so bad. That is when I looked in their eyes, that is exactly how they were looking at me, not with disdain or disgust or anything like that, but of concern and, oh, that guy looks awful. I went right up and went into the cath lab and did a radial artery. I had 100% occlusion, my RCA, and they stented it. And they gave me, I think they gave me 2 injections for IV injections for pain, but the pain was still there. I was still very aware. I could feel the effects of the medication. But as soon as I was stented, the pain was relieved and went to the cath lab recovery area. My family came down and were very upset. But I was stable then. Hey, I got this done and was admitted to the ICU. I think I was there about 3 days. Some of that part was a little more cloudy. The care I received was excellent. I had excellent nurses, physicians, everybody they were just so nice to me and respected, that I was a nurse. I think at some point, I don't think the cath lab people knew that at all. I'm not going to say, "Hey, I'm a nurse, do this," or whatever. I was just like, I'm having the big one here. I had excellent care, excellent teaching. And sometimes they would come in and they would say, "Now I know you know this, but here we're going to go over this." And I'm like, I'm a really good emergency department nurse. I'm not an ICU nurse. I'm not a cath lab nurse. I'm not an MI nurse or cardiac rehab nurse, things like that. So I very much appreciated that information. Unfortunately, because this occurred when I was 65, I was a fall risk. And there is nothing, stop laughing. There's nothing more humiliating than getting that yellow bracelet on. And I had to wear the damn socks to say you're a low risk. I'm like, put the scarlet letter on my forehead, for gosh sakes.
It's a yellow letter, not a scarlet letter, right?
Yeah, it should be. It should be. But that was funny. And I was like, I guess I need assistance if I have to go to the bathroom. And they're like, "Yeah, you do." I'm like, "Oh my gosh, don't tell me this." They were very sweet, and I learned a lot about being on the other side as far as there was a couple things they said, you need to do this and not do that. I very much appreciated that they really worked with me because I just wanted to get out of that hospital in the nicest way. And they're like, we have to worry about vasospasm over the next 24 hours. Okay, I get that. Okay, 24 hours is up. Can I go home now? And they're like, let's just do this or that. I was able to be released a little bit earlier, but I'm a compliant person and I obviously did whatever they told me to do. But I learned a lot about that and being on the other side of the bedside, I just had nothing but positive experiences. I did not have Nurse Ratchet. I didn't have somebody who was intimidated by me that I know of. I just had really good care. And as I said, Nurse Ratchet, there's probably people listening who don't know who Nurse Ratchet is. So they may have to Google that. Okay.
One flew over a cuckoo's nest.
Yes.
Yeah.
Louise Lasser or something like that. So
What was the most difficult part for you while you were going through this experience? Was it the knowledge of, oh my gosh, I'm having an MI? Or was it something else? You're shaking your head no.
I'm shaking that the most difficult part for that is being in the dependent position, having to depend on other people. I just thought, oh my gosh, they've got to take me to the hospital. Like they have to call the squad. I have to do that. And I also felt really bad that I let them down. I was going to be the opening speaker. I was going to start talking at 7:30. And so I said to them, I'm so sorry. I'm so sorry. And I was saying that this is so stupid. But I said it. I go, now, if I get there on the ER and they get this checked out and this is like costochondritis, I'll come back and do the closing for you all. And they're like, oh, okay. Yeah. Okay. Thank you. Okay. Like that. And I'm sure
They
thought
thought you were crazy.
I know what an idiot he is. He's having an inferior lateral MI. Okay. Yeah. But I just felt so bad. But being in a dependent position, having to depend on people at that time and later, and I don't think I'm a control freak. I just like to do stuff. But to have people go pick up my medicine and I couldn't drive for a while and all of those kind of things and people to make me feel that's a difficult position for me to be in because I'm on the go. I'm not crazy on the go because I've had people say, now maybe you need to slow down. I take care of myself. And interestingly, I'm a very heart healthy person. I do not eat red meat and haven't for years and years. Don't smoke. I do not eat any desserts. I don't eat any sweets at all. I walk. I'm not a high stress. I work in a stressful environment, but I'm a fairly easygoing person. But things that you cannot change are hereditary, age, and your sex. And hereditary wise, my dad had terrible cardiovascular disease. And both of his parents both died of sudden cardiac death in their 60s. So the fact that I survived at age 65, I am extremely grateful for. And it's hard to, again, then I got to take this medicine. I'm going to cardiac rehab, those kind of things. I'm doing check everything that I need to do because I want to get better. I have a daughter. I have a granddaughter. I don't plan on retiring. I like to still work and be a contributing member of society, but I'm not doing 12-hour shifts in the ER, those kind of things. I know my limitations, but I've just always been a person who's tried to take care of myself and not be, oh, just a crazy fool and run around and do this. An interesting thing, Nick, you'll like this. The cardiologist I saw him, I said, do I have to give up beer? He goes, are you? And I said, I don't think so. He goes, you don't have to give up beer. I said, I like you. I'm gonna recommend all my friends come to you. He goes, do you want to switch to red wine? I said, you know what? No, I'm not a wine person, but to have a couple beers on a Friday and Saturday night with I don't know, with some kind of Mexican food or pizza or whatever, go for it. There's nothing better than that, but it's not like I'm just like drinking beer all the time. And I like that. And my cardiologist said, beer is a vasodilator. And I'm like, oh, we got a little panto going on here too. Thank you. So it justifies it. Anyway, but being dependent has been the most difficult part of this. But I have learned and I have adjusted. And I was off work I was off work November and December. I have not been off for 2 months since I started working in 1975. Isn't that crazy?
Just to play the devil's advocate for a moment, at the
Sure.
time that this event happened, you were the president of the Emergency Nurses Association, an
Yes.
international association with over 50,000 members, highly well known and in the care of people that knew you. A lot of things went well. How much of that do you think is attributed to, frankly, who you were and in the company that you were in? And how much of that was, gosh, if this had happened to anyone else at a meat packers conference in Lexington, if we called 911, the care would have been the same?
And you know what? I don't know that I can answer that, but I would tell you it certainly helped. And I'll believe that. I mean that with all honesty, to have the people on board that I had there certainly helped. But I do believe, had it been a meatpacking conference and the squad was called there, I think that person would have gotten the same type of care and taken straight to the cath lab. We certainly get those on our STEMI calls. We don't say, who is this person?
Yeah.
And so we streamline that to make it very efficient. So I think all of those processes would be in place for anybody, but I'll be honest with you, it certainly helped in my situation. I do remember one of the night shift nurses came in, young nurse, very nice, and she was like checking me out. She goes, "Somebody told me you used to be a nurse," and I was like, "Oh, God, I oh, heck no." And she was like, "Oh, I didn't mean it like that. I didn't mean it like that." And our back came up out of that bed. I was like, "Okay, you have an MI and they take away your nursing license or whatever." And so she was profusely apologetic for that. But I knew what she meant. So I was like, she didn't really know. And some people would be like, ENA, what's that mean? But to just reflect on being the ENA president, there were so many times last year where I flew all over the country. This could have happened mid-flight, and God only knows. I was in
Yeah.
Calgary, Alberta, Canada. One time, like 2 weeks before this, I flew to Hartford, Connecticut, I worked all day and got there at 12:30, got to my hotel at 1:30 and had to speak the next morning. Like it could have happened that night all by myself. All of these things. My daughter lives in a rural area. It's 45 minutes from an emergency department. It could have happened down there where I was watching her by myself. All of those things, it could have happened. And so it was very fortunate that it happened where it did happen, because all of those things in place definitely had a profound effect on my ability to survive. As a matter of fact, I remember when they put me in the squad, the paramedic said, "Let's sit you up here and put the pads on." And I was like, "Yeah, let's put those pads on. Let's get those puppies on right now," because I knew I was having an MI and I wanted to have the pads on it as soon as I could and stuff. So all of those things went into place, but I'm very lucky and very grateful to God that I survived it.
We're recording this about 4.5 months after your MI. How you feeling?
Actually, I feel great. But Nick, here's the other thing. I feel great up until that event. I had people ask me if he had any associated symptoms, anything like that. Not that I can remember. And I'm, again, not a denial person. I feel fine. I'm doing cardiac rehab 3 days a week. I'm in the phase 3. I want to continue to do that for the rest of my life. I enjoy it. I don't know why they have me in a class with a bunch of old people, but I'm there. So I look around. I'm like, seriously? Okay, this is like a scene from Cocoon, but I'm here and I'm going to get it done. But you have to have a sense of humor about it. And I have very much enjoyed my cardiac rehab.
Speaking of cardiac rehab, we're going to wrap up this episode so that you can get to cardiac rehab. I know you have that in
Yes,
about 31 minutes. Any
I
closing
do.
thoughts as we wrap up this episode?
I'm just very grateful, as I said, to be alive. And I've learned a lot through this. And I learned that people were very reassuring to me when that was going on. And sometimes when there's nothing you can do, those nurses in that lobby, there was nothing they could physically do for me. except to reassure me. And hearing that reassurance, "Oh, it's going to be okay. I'm here with you." That meant so much. And I always want to remember to keep doing that for patients. But just, I owe my life to the medical community that I've been a part of. So to everybody, thank you. And thank you for what you do. And I mean that with all honesty.
Being fully present for the patient truly does make a difference. That's what I'm hearing from you, Terry.
It sure does. I wouldn't recommend being a patient, but it does. Okay.
A nurse's view as the patient has been our episode topic with Terry Foster. Terry, thank you so much for joining us today. Appreciate you being here for a third episode.
Thank you. Thank you very much.
You've been listening to the BRG Nurse Executive Podcast, which focuses on improving patient care by advancing nursing leadership. The views and opinions expressed in this podcast are those of the host and podcast guest and do not necessarily reflect the opinions, position, or policy of the guest employer, Berkeley Research Group, or their other respective employees and affiliates.